We have now administered more than 2.27 million doses of COVID-19 vaccine. More than 50.5% of Albertans aged 12 and older have now been vaccinated. Over the last 24 hours, we have identified 908 new cases of COVID-19 and completed nearly 10 tests. Our positivity rate currently stands at about 9.1%. There are 685 people in hospital being treated for COVID-19, including 185 in the ICU. Sadly, I must announce that 6 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of all those who have passed away. Each death reminds us that we are not yet through this pandemic and that we all need to continue to follow the restrictions in place to bring our cases down. I have previously said that long-term, vaccines will allow us to ease restrictions in our continuing care sector. With vaccination numbers rising, I want to advise Albertans of changes we will be making to the operational and outbreak protocols of continuing care facilities. These changes take into account not only the positive impact vaccinations have had in these facilities, but also recognize the toll that COVID-19 has had on the physical and mental well-being of residents in these locations. As more Albertans become vaccinated, including at continuing care facilities where the vast majority of residents are fully vaccinated with 2 doses, we are able to safely ease some restrictions to increase the quality of life, health, and well-being of residents. The most significant change we are making is a shift to a vaccination-based approach for assessing any additional precautions for new residents and residents returning to a facility from outings off-site. Effective May 31st, residents will no longer be required to be in quarantine upon admission to a facility or when they return from same-day or overnight outings. All residents will undergo a health assessment screening upon return to a facility. The precautions for residents who pass the screening will be based on the vaccination status of the individual. Fully vaccinated individuals require no additional precautions. Partially vaccinated and unvaccinated individuals will need to provide twice daily symptom checks for 14 days. Regardless of vaccination status, there are certain instances where residents may still need to quarantine, including if they don't pass the health screening upon return to the facility, and also if they've returned from international travel, being a close contact of confirmed cases of COVID-19, or if they have symptoms. Quarantine will also be required if a resident, regardless of vaccination status, returns from a unit within a healthcare facility that is on an outbreak. While there continues to be a small risk of exposure to and transmission of COVID-19, a number of safety precautions continue to be in place to ensure continued protection for residents and staff in these facilities. These safety measures include health screening before leaving the facility and upon returning, masking, physically distancing, hand hygiene, and symptom checking. These revised standards have been developed in consultation with stakeholders and after hearing feedback from over 2,500 Albertans in telephone town halls over the last few months. If you have a loved one in a continuing care facility, or if you're a resident in a continuing care facility and have questions about these changes, please contact the operators of the facility directly. And please be patient as each facility works with families and residents to implement this change by May 31st.